L3, L4, so it's kind of wrapping around here, okay? So when she goes to bend forward, I'm going to just kind of look at her motion. She's going to tell me if that increases, decreases your pain.
It increases.
Okay, and then come on back up. And does it go away once you come back up?
Yes.
On that 0 to 10 scale, where did it go up to? A 3, okay. And right now while you're standing here, do you have any pain, or it's a 0 right now? Okay. And then if you would put your hands on your back like this, and I want you to go backward, you know, just kind of, I usually, if they have a gown on, I can kind of look, but otherwise I kind of just looking. Does that increase your pain?
Yes.
It's more so than going forward, right?
Yes.
And is it more on the right than the left?
Yes.
Right, because she's compressing that facet joint on that side. Would that make sense to you? And on a scale of 0 to 10, what would you give that?
4.
A 4, so it's a little bit higher. She's probably getting it bending forward just because she's got some tissues in there that are a little bit tight, but I'm going to kind of see, I don't know, it hurts her both going forward and back, so I'm not quite sure other than that she's got some pain down this leg, whether it's a facet joint or maybe a disc or something like that, so I'm not sure yet. So now I'm going to have her put her arms at her side, and because it's this side, I'm going to have her side bend away first, thinking that that's going to open that up, and yeah, just go down, look straight ahead. And I kind of look to see if there's a curve here, and it's nice. Any pain with that?
No.
Okay, good. And then how about when you go to the other side?
Yes.
And she's not going as far, and I'd kind of mark and come on back up. And where did you feel that pain?
Down where I usually have the pain.
Okay, and did that go back away as soon as I brought you back up, or did it linger a little bit?
It went back to no pain.
Okay, good. And what was it when you were down there?
Like a 3.
It's a 3, but it caused some pain down your leg.
Yes.
So this one, the other ones didn't. This one caused some ridiculous symptoms for her. And I'm going to have you cross your arms, cross your chest. And I usually show them all these first, what I'm going to do with them. Before I do it, I'll just be in front of her and show her what I want. So now, do you guys think right rotation or left rotation goes with the right side bend?
Right.
Left rotation will go with right side bend. So I'm going to have her right rotate first, because that's going to open that side up. Any problem with that? Hi. She's got normal range. Feel okay?
Mm-hmm.
Good. And then how about when I have you go to this side?
And that hurts.
And that hurts. You don't go quite as far. I can't say hi to you as much. And is there anything going down the leg?
Yes.
Okay. And then when you come back, is it okay?
Yes.
Okay. All right. So ideally, let's say that now you're stirred up and you have a little bit more pain here, about a 3, and it's going down right here.
Okay.
Okay? So that's her symptoms for me. So what I'd like to do, Lindsay, is I'm going to have you lie down. Remember the log roll we showed you?
Yes.
So this is where the log roll is going to come in handy, right? Unlike with our fractured tib fib the other day. There we go. Down you go. And because it's her right side, I probably would have had her get down on the table the other way, because here she had to compress that side a little bit. Comfortable? Mm-hmm. Okay, so we're going to just do a little bit of traction on there just to see if you're a good candidate for a mechanical traction. Okay. And basically all that does is you have those joints in there. Can somebody give me the lumbar spine? This is where you guys are going to want to use your anatomy skills with your patient during your practical. It's really good to be able to explain to them what you're doing with the traction and why it's doing what it's doing. So I didn't prepare it, so you're marking me off a point or two there. Oh, look at, we got a new one.
Yeah.
Oh, that's exciting. Yes. Wow. I'm kind of afraid to touch this guy. All right, so here's your spine, right? And we have these little joints back here. They're called your apophyseal joints or facet joints, all right? And so there are kind of our weight-bearing joints of our spine. And sometimes they get stuck and they don't glide the way they're supposed to. So we want when you rotate and when you side bend, they should kind of move nice and easy. Right now they're not, and so see, here's your nerve. And you're at about L3, L4 is where I'm guessing it's compressing and it's causing some pressure there. But not a lot because it goes away, which is good. We don't want it to cause you numbness or tingling or weakness in your leg. So we did all our testing, the myotomes, the deep tendon reflexes with her, all in her eval, so we know that that was all okay with her. So what happens when you side bend to that side? Can you see how that compresses there? Mm-hmm. And it narrows this spot down and it makes that, so if I open that up, can you see how that takes that pressure off? Mm-hmm. And then also, if I bend you like this, can you see how that also does it? Mm-hmm. So that's what we're gonna do. We're gonna try a little traction this way first, and then I'll show you some positional traction that you can do at home that'll do this kind of guy.
Okay.
All right, any questions?
Nope.
Good to go? So I have this handy little mulligan belt, we call this. Definitely not in my right attire for this today. Stay out of the way so I don't trip and you don't trip. And I'm gonna be just scooched in just a little bit more. And this- that's down, but this guy.
Oh, he's not.
So this is where you're gonna like the ones that have the things on the end better when you're adjusting for it, as long as this can move while you're, we're going up, okay, no falling over.
Okay.
Okay. So we're just gonna come under your figure 8. And the important thing with this is to make sure you're not putting it up here, that you're really putting it on your butt. Why do you guys think I don't want you putting it up here? You're gonna mobilize your spine, right? Yeah, you're gonna be hypermobile before you know it. Okay, up a little bit. So I guess I should have just done a single leg, sorry. Jumping the gun here. So adjusting the belt's probably gonna take you the longest. Okay, and I'm just gonna come in and, why didn't I put my hands under there?
For the comfort.
Yeah, so that the belt doesn't dig on her, right? Yeah. So with her, we know it's like probably L3, L4 just because of the way she's talking about her leg, okay? And so if you guys can remember from, this is such a slippery floor. So I'm gonna put her up, okay, a little bit. And then I'm gonna give her, I'm just gonna sit back. I'm gonna slip, so I'm gonna use that. How's that feel?
Good.
You feeling any pull yet?
More just through my legs and my side.
Okay, so let's come up a little bit more. And I'm gonna bring you up a little bit more. Can somebody lower that table? Take my shoes off. Okay, and I'm gonna come up a little more. Lower, a little lower for me, Alice, I'm sorry. No worries. There we go. Keep going, keep going, keep going, keep going. Perfect, thank you. So because I want her inflection, and I want her to feel it in there, come in here, and I'm gonna come a little bit higher up. Is that better?
Mm-hmm.
And then I slowly, gradually get to her where I feel it. Tell me what you're feeling. Same, better, worse?
Better.
Better? Where's that pain in your leg going now? Is it still down your leg, or is it pretty much just in your back now?
More just in the back.
Okay, and what's your pain level?
2.
2. So the type of shoes is important.
Yeah.
Can you say it? I'm
I don't want you to
struggling.
slip.
Right, I know.
Yeah.
But I want to be back here, but this is making me slip, so unfortunately, and see, doing that's going to jar her. Sorry, luckily she has no pain. So am I going to just say after my 5 to 10 minutes, you can see why I like to hang out against the wall? Am I going to just say, okay, that's good, and let her go? What do I have to be careful of?
The rebound.
Rebound. So why don't you take some nice deep breaths? And I'm just going to slowly let that come up. You doing okay? And then just slowly let it come down. How you doing? Good. Good. And then I want you just to bring your knees up for me. Okay. Doing all right? Good. So that would be single leg with the belt. I could also do it manually.
So is that basically the same thing as long axis distraction?
Great, so now we're just isolating out the spine a little bit more, okay? And she can feel her spine a lot more here, I bet, than she could when it was
Higher
down
up. Yeah.
there. Because I shortened my lever arm a little bit. Okay?
Yeah.
All right. And then if I wanted to do bilateral with her, I could use that belt again, do the double thing. If she's down here, the more extension you want in, the higher up the table you're gonna want it to be, right? Versus if I wanna get her into flexion, I'm gonna be more here. How's that feeling? Okay. So this is if that traction patient, you wanting to test them, yeah.
Do you have to be careful of like knee hyperextension?
Absolutely.
Some people's knees who have like hypermobile.
You have to rule everything out, their hip, their knee. So if I have a total hip patient, that hip fracture, am I doing this on them? Even though they have a lumbar issue? No. So I'm gonna have to isolate out, and that's where we go to this one. Right? So this, you could use a towel, you can use a belt. I use the towel here. I'm gonna put the belt over versus, why do you think putting that over versus under her knees is, what would be the rationale of one over the other?
You won't distract the knee joint?
So this is really gonna isolate out
No.
a little bit more. Can you come down towards me?
Don't see it.
A little bit more. Good? Make sure it's not twisted. Level looks just right. Okay, so I'm just here. The belt's just there to help me this way. Okay, so I'm kind of got it grasped here. I'm underneath her. I'm as close as I can to her hip joints there. And now, how does that feel? That's good. Now, do you feel that more in your lumbar spine than the long axis we just did?
Yes.
Can you describe to the guys what you feel differently?
I guess just more, like there's more space.
Yeah. Because we are now isolating out, right? Right where we want to be. That make sense? This isn't so bad on my back. I could sit here for a while. Okay? Some people will put it up above here instead and just raise the table for themselves. You just do what you want. When I do this sometimes, depending on what they have, I might do more of a scoop. So I'm going to do a little here, and then I'm going to go out.
Oh.
Feel different? Just a little. Yeah. So that may be if they or there's just a little bit more pain somewhere that they're feeling. I'm going to kind of try and gap it first, and I'm going to do my distraction.
So are you using a lot of your arms on that?
I'm not. I'm using my butt.
Well, yeah, I see where you was pulling.
Yeah, this is just really here for positioning. I'm really not, because I'm like hugged into her here, Dennis.
Yeah.
So I'm just kind of sandwiched into her here, and all my force.
You're also doing a little bit of the scooping too, so maybe something into your wrist.
Okay.
Yeah, but I'm really not doing a whole lot. My belt should probably be a little bit longer so that this is just right there.
So are you leaning on her knees? Your
I
chest is
am.
leaning on your knee? Okay.
I am, and then I'm just coming
Right,
back.
okay.
Does that bring her into
Go ahead.
anterior pelvic steps a
A
little?
little bit, so that would be that patient. That's what we were talking about, that scoop is going, that's for that person. You're not gonna like that as much.
Yeah.
Yeah. So that's where the nice thing about manual therapy is you can isolate it out to your patient and what's gonna work for them. So then we saw like in the video, so I'm gonna, I guess I'll do it the correct way. She can lift her legs, but your back patient probably can't. That's why they're here with you, right? So they had a couple different ways they did it, right? He did it off the table, where he's just here. And tell me how that feels. Better, same?
I feel like less distraction in the lumbar spine, but it feels good like on my legs.
Yeah. So a little bit less. Okay, now scoot up towards the top so I can get on the table with you.
Okay.
And he did it a couple different ways. So he wanted to change his angle a little bit, so he had his arms up here. Yeah, here, I think. Okay. And then he was just here. How's that one feel?
That's good. Yeah. Because Because I feel like it's just like going up.
It's really, and so you can see the
It's just like-
angle, so versus if I'm down here and I do that,
Yeah,
right?
up is better.
Versus here. And do I need the belt? Maybe. I need the belt. But some people, but we're talking about longevity, right?
Yeah.
But if you don't have a belt in your clinic, use a towel. Improvise, right? You could have a long towel and you could put that in. And that's gonna help me a little bit. Don't fall back. Don't fall back? Yeah. I'm stable. Okay, so, and if I want to do one side versus the other, I might just come in here and just do the one side.
Gets your hip more too.
Just definitely get the hip more. It's a safe one when you're trying to isolate and leave the knee out of the equation. Okay, so those are all, and then prone is going to be the same as supine. You're just, you want to go ahead and flip over and we'll just see how that feels. I'll let you guys try these. And I'm going to show you the, what are we doing on time? I'm going to show you the positional traction at the same time so that way you have two things you can be practicing. Okay? So this one I'm going to need her up a little bit higher. So same thing with this one. I'm going to use my butt more just so I get more of a direct angle with her. Okay? I could do this bilateral or single. Sometimes you just do this on one leg. I have to be a little bit more careful because she has a little more extension. I'm going to have her put her arms down at her side and just kind of relax. Maybe more off the table. Just kind of hang them off the table for me. Yeah. You okay there?
Yep.
And then we're just going to do it. You feel that okay?
Yeah, I feel it more in prone than supine.
So here
More
we're
distraction
really
there.
isolating out that area. And we can see with her, right? We see that curve in there with her. So it makes sense, yeah. Any pain with that?
No.
And then again, I'm slowly letting up, right? So I don't get that rebound effect with her. If I'm wanting to do more like an oscillation with somebody, I could hold like you do on the traction for 30 to 60 seconds and then let up for 10. I could hold for 60. So that would be more that soft tissue, that disc problem, right, that we were talking about, versus if I want the joint distraction, I'm probably going to hold evenly, right, a longer period of time in between, and doing it up to 10 minutes if I can, ideally. So then once we're done, how's that feel?
Good.
Any pain anywhere?
No.
And then the other question besides pain is any numbness or tingling, funny feelings?
Nope.
It's all gone? Nice. Okay, so now you're going to roll onto this side for me, please. And then onto your back. Because it was this side, right? That was causing you your issues?
It was.
And I'm not leaving you, so I'm going to leave the table up. If I was going to leave you, I would lower that table. Get you at a nice height for my body. So at home, Lindsay, sometimes we talked about how to gap that. And our longer spine is actually good for that because it actually moves. Does anybody want to go grab me the guy who's like, you know, the tall guy? Thank you, Kevin. I won't do anything till you get back, I promise. You guys can say hi to the camera. Say hi to Dr. Smith and Professor Eckert. Hi. Tell them how great your East Imaging was today. And warm out. They're thrashed. Jelly donut and all. Well, they're all dehydrated. Maybe you just can't find it. We can pause it for a second.